Yeah, okay. I'm sorry. Yes. And the panelists we invited today are organized in collaboration with Japan Association for Social Policy Studies. And first, right after my talk, Professor Yamada from the Department of Sociology, Komazawa University, will present about the pandemic and its influences on workers, some experiences in Japan. He will first show the overall trend of the labor market performance since the beginning of the pandemic, then turns his focus on the impacts of that pandemic on migrant workers, who can be possibly the most vulnerable existence in Japanese labor market. Then Koji Takahashi, a vice senior researcher from the Department of Employment Structure, the Japan Institute of Labor Policy and Training, he will present about the impact of the COVID-19 crisis on non-standard employment employees in Japan, focusing on the non-regular or non-standard employment segment in Japan. And finally, Yuka Omura, a manager from the Department of Labor Policy of Japan Nursing Association, she will present about the COVID-19 pandemic and nurse in Japan, focusing on the essential workers in Japan. At last, Professor Suzuki from Ohara Institute of Social Research, Hosei University, will discuss and make some comments and raise questions to these presenters. So since we really have a very short session, we would immediately start the first presentation. Professor Yamada, the floor is yours.
Okay, thank you. So I'll share my slide. So thank you for having a chance to make a presentation in this session. So first of all, I would like to review the outline of my paper. The purpose of my paper is to address foreign workers or migrant workers in Japan and clarify how COVID-19 pandemic is affecting them. So foreign workers in Japan can be one of the most vulnerable workers in the pandemic COVID-19. So after taking a look at the influences of pandemic on the economy, the decrease of GDP and the increase of unemployment, so I'd like to make sure the situation of foreign workers and the institutions for immigration in Japan. So lastly, examining damages on foreign workers in the pandemic, I'd like to suggest what is to be done for foreign workers and the immigration system. So this slide shows cumulative infections of COVID-19 in Japan. We have over 600,000 people infected. So in accordance with the increase of infections, GDP in Japan rapidly decreased. We can see a rapid decrease in 2020. So unemployment also increased, while full unemployment in Japan was not regionally so high. So what are the influences on foreign workers? So first, I will let you know the Japanese immigration system in some detail. So we have a very stringent immigration system in Japan. So basically, a so-called simple worker, that means a worker with no special skill. Tanjun Rodosha in Japanese, that is prohibited from working in Japan and is not eligible to obtain a working visa. So therefore, workers with no working visa are illegal workers and cannot stay in Japan. So on the contrary, a worker with special skills, for example, a professional baseball player, university professor, and a professional singer, and so on, has eligibility to obtain a working visa. So, however, so the immigration system was devised in 1919 and enforced in 1991. So as a result, even simple workers, if they have Japanese ancestors, can work in Japan. The reason why foreign workers with Japanese ancestors can obtain eligibility to work is thought to be based on the same principle as that of how nationality is acquired. In Japan, the nationality of a child is determined by the nationality of his or her parents. So whether or not foreign workers can work in Japan is based on the same principle of acquisition of nationality. So the background of this revision is because many companies were very short of workers and they needed flexible labor forces in those days. So as a result of many Japanese, Brazilians, and Peruvians rushed into Japan to work with various factories in Japan. So because many Japanese migrated to Latin American societies in the pre-war era and in the 1950s, so there are many Japanese, Brazilians, and Peruvians. So nowadays, the majority of these workers have shifted to Filipinos because the category of foreign workers with Japanese ancestor are limited with the third generation. So nevertheless, another type of foreign simple worker has been admitted to work in Japan. They are called technical interns. So binoji shusei in Japanese. The technical interns are not juristically workers. So they are only trainees dispatched from developing countries and Japanese transnational subsidiaries on the basis of the Japanese technical internship program. So this system was established in 1993. Its aim is officially to let these trainees train and to develop their skills. However, they are often forced to work for extremely low wages in small and medium-sized enterprises and in the primary sector. So this means there's technical interns or workers for marginal farms and industry. So most of them were Chinese and some Indonesians, Vietnamese, Filipinos, and Thais were included. However, the majority of them has shifted to Vietnamese. Furthermore, the reasons why technical interns drop into inferior working conditions is that they cannot choose their employers by themselves. So they are allocated to work employers by management institutions in their home countries and Japan. In short, it is determined which employers will employ them. So if they leave their employers, they are regarded as illegal visitors and mandatorily sent to their home countries. And in 2018, a new type of foreign workers were introduced, a specified skilled worker, Tokutei no Roudosha in Japanese. Due to the labor shortage caused by low fertility, the increase of labor demand for the Olympic Games, and so on, the government decided to introduce a new category of specified skilled workers. So, so they fall into two types. Type 1 applies to workers with skills which need enough knowledge and experiences. The type 2 also applies to workers excluding skilled jobs in specific industries. So they are different in industry, staying period, family reunion, and the qualification. So these technical interns are one of the most vulnerable workers to the pandemic and economic downturn. So the decline of the economy in Japan due to COVID-19 pandemic made serious damages to some industries, and the foreign workers lost their jobs. However, the institution cannot allow technical interns to switch to other jobs on their own. So therefore, they had to be unemployed. So furthermore, pandemic caused flight cancellations to their home countries. So therefore, many of them were not able to come home. So as a result, many technical interns turn out to be illegal visitors because they are not employed. So this means that as a type of the social week, technical interns are apt to be excluded in case of irregular situations such as pandemic. So in fact, many shops dismiss technical interns under the pandemic, and therefore many interns can be unemployed from now on. So regarding such social exclusions, we have some episodes. I'd like to introduce one of them. So many Vietnamese workers lost their jobs due to the COVID-19 pandemic and were not able to return to Vietnam due to flight cancellations. Therefore, they left their employers for new jobs. They lived together and make a community in the suburban area of Tokyo, Saitam Prefecture. So they live with their compatriots and families, and they support mutually. So they are recognized as disappeared foreigners, and so they should mandatorily be returned to Vietnam if they are found by the authority. So 5,885 Vietnamese disappeared in 2020. If they want to stay in Japan, they need to obtain special permission to stay from the authority. So given such a situation of foreign workers in Japan, what is to be done? So first, the drawback of immigration system in Japan should be revised. This system can institutionalize unfree labor forces in capitalism. Second, the present system only regards foreigners as labor forces. So put another, foreign people are not, foreign people are only grasped as workers who can be easily disposed. So they are not recognized as true migrants who live together here in Japan. So therefore, such system should also be revised. So thank you for your attention. Thank you.
Thank you very much. Next, Professor Takahashi.
Okay, hello everyone. I'm Koji Takahashi. I'd like to talk about the impact of the COVID-19 crisis on non-standard employees in Japan. COVID-19's impact on the labor market is uneven. In my understanding, in the United States, service workers, female workers, and those of Hispanic origin are reported to have been severely affected. In Japan, service workers and female workers have also been affected. In addition, in the case of Japan, we know that non-standard employees are vulnerable to economic crisis. Most non-standard employees are part-time or fixed-term contract or dispatched workers. However, substantially, they are labeled as non-standard in line with HR system of each firm. Such HR system is embedded in the Japanese-style employment system that divides its employees into members and non-members. Historically speaking, non-standard employees were utilized as employment buffer to protect long-term employment practice for standard employees. In fact, after the financial crisis, many dispatched workers in manufacturing industry have had their contracts cancelled and been pushed into poverty. Then, how about the impact of COVID-19? Optimistic prospects is like that. The Japanese-style employment system is not so prevalent in the service industry. It is typically found in manufacturing industry. Thus, non-standard employees will not be severely affected during the pandemic. On the other hand, pessimistic prospects are like that. First, apart from the Japanese-style employment system, employers may pay more attention to retaining standard employees because they have become more precious due to labor shortage. Second, in the service industry, there are many part-time workers who are the most vulnerable in the labor market. Then, I will examine the economic and employment situation using official statistics. Let's take a look at trends in macro indicators. As you can see, compared with the financial crisis, the unemployment ratio is lower and more stable, even though GDP shows sharper decline. This was because many businesses temporarily made their workers go on leave and or reduced working hours instead of dismissing them. The upper chart reflects the number of workers who are furloughed. The lower chart shows working hours reduction. Although general indicators are not necessarily devastating, we can find uneven employment losses during the pandemic. The number of female employees decreased considerably. However, if looking at precisely, we can see that there are so many female non-standard employees, and the number of non-standard employees decreased drastically. Service industries such as accommodation, eating and drinking, and living-related services and amusement lost a huge amount of employment despite their small industry size. However, we have to keep in mind that non-standard employees disproportionately lost their jobs within each industry. In fact, non-standard employees suffered from employment losses, even though the number of standard employees increased. The left circle shows the decline after the financial crisis, and the right circle shows the decline during the pandemic. Let's move on to the work and lives of non-standard employees during the pandemic. Our institute, JILPT, conducted a web-based nationwide questionnaire survey in 2020. I will analyze the answers from standard and non-standard employees who continue to work during the pandemic. First topic is working hours. working hours index of non-standard employees has been lowered in May last year. It was about 83 points in the second week and 87 points in the last week in May last year. Regression results. This table shows that especially part-time and dispatched workers lost their working hours. In addition, even if controlling for personal and occupational variables, disadvantage of non-standard employees remains. In relation with working hours reduction, we can find that non-standard employees were more likely to be furloughed. In addition, they tend to be furloughed without enough allowance. Please note that this tendency is apparent in part-time workers. More than 40% of part-time workers were furloughed without sufficient allowance. As for income, monthly income index of non-standard employees has decreased during the pandemic. About 40% of non-standard employees said their monthly income has decreased. Regression results. The upper table shows that especially part-time and dispatched workers suffered from income decrease. In addition, even if controlling for personal and occupational variables, disadvantage of non-standard employees remain. The lower table shows that order of absence without sufficient allowance partially explains the gaps of monthly income index between standard and non-standard employees. Finally, we deal with well-being. When we look at the change in job and life satisfaction levels before and after pandemic, non-standard employees seem to experience severe decline. These tables show that part-time workers' well-being has deteriorated especially. In addition, even if controlling for many variables, disadvantage of non-standard employees remains. Next slide shows that decline in well-being of non-standard employees can be explained by working hours index, absence order without sufficient allowance, and monthly income index. So, conclusion. Characteristics of the gaps are as follows. First, non-standard employees suffered from employment losses, even though the number of standard employees increased. Their working hours were shortened without sufficient allowance, leading to a decrease in monthly income. As a result, well-being of non-standard employees has deteriorated. In particular, part-time workers and dispatched workers seem to be affected more than others. Then, what were the causes of the gap? First, the importance of standard employees induced the situation in which non-standard employees lost their jobs while the number of standard employees increased. Second, part-time and dispatched workers share hourly wage system, and it may have contributed to reduction in working hours. Third, originally, there were no government subsidies for absence allowance for some part-time workers. They were implemented amid the pandemic. This may cause employers to fail to apply for it. In some, in service industries, in other words, outside the Japanese-style employment system, current HR policy, difference in wage system, and institutional separation have jointly created disadvantage for non-standard employees. Thank you for your attention.
Thank you very much for the presentation. The third presenter is Professor Omura. Please start your presentation. Omura-san, you're muted.
Yeah, I'm sorry. I'm sorry. My name is Yuka Omura of Japanese Nursing Association. Today, I'm going to speak about the actual situation of Japanese nurses at the forefront dealing with COVID-19 and the efforts of the Japanese Nursing Association. But my presentation does not represent a formal position of Japanese Nursing Association. This is there are the topics I will be talking about today. About JNA, Japanese Nursing Association is established for the licensed public health nurses, midwives, nurses, and assistant nurses in 1946. 740,000 of nurses are joining in JNA. First, I speak to current status and issue of nursing in response to COVID-19. Due to COVID-19 pandemic, community medical system is on the verge of collapse. It is a great impact on emergency response, normal medical care and work. Healthcare professionals are working with the conflict that can save the life that should be also to save. Also, nurses are exhausted both physically and mentally due to long-term response to COVID-19. The biggest problem was securing human resources. So April 7, 2020, the government declared a state of emergency. JNA sent a job request emails all at once to 15,000 nurses registered as a nurse center who are not currently working to return to profession. The result, 4,245 latent nurses returned to profession. COVID-19 consultation service call centers, accommodation facilities for midnight, for mild case, they work. And we started the consultation service for nurses regarding to COVID-19 service for nurses. We have 1,000 consultation. That is details like this. So JNA made request to government in order to ensure the safety of nurses by identifying the needs and issues in the front line through the opinions received by our consultation service. Based on a total we request 636 requests to the government. Based on our request, the government implemented necessary measures, including the payment of reward money for healthcare workers, dissemination through the government policies concerning the provision of discrimination and prejudice against healthcare workers, and the revision by notification of Equal Employment Opportunity Act in order to restrict work and job attendance of pregnant workers on condition of advice from a physician or midwife. Our efforts contributed to the attainment of these measures. And we did a survey. To grasp the situation in September 2020. This is a survey outline. Today, I would like to introduce some of the answers to hospital nurse administrators and individual nurses. A total of 46% of hospitals that accepted COVID-19 patients made changes to nurse staffing. Overall, 32% said that they had a shortage of nursing staff, but hospitals that accept COVID-19 patients said they had a shortage of 45.5%. And in the survey, 15.4% of hospital answered that some nurses left jobs due to COVID-19 related reasons, such as change in the working environment and the risk of infection. In particular, hospitals that were designated to accept COVID-19 patients, such as designed to medical institution for infection diseases, exhibited a high rate at 21.3%. Looking at the changes in the working environment of nursing staff throughout the nursing department, they answered that there was a great bias towards some staff, such as the number of night shift hours and overtime. As already stated, about half of the hospitals that accept COVID-19 patients have closed some wards or reduced changes in their practices. As a result, the nursing staff was changed and the patient care was concentrated, which is true to have caused a difference in the amount of work among the staff. Of the 38 and 335 people who answered that they are currently working, for 55.1% were engaged in work related to COVID-19. Actual status of prejudice and discrimination against nurses. 20.5% answered that prejudice and discrimination existed. 27.6% answered that nurses' families or relatives received verbal abuse from people around one. The intention to continue working as the overall nursing staff is high as about 80. I'm very glad. However, those who have a discrimination prejudice have less want to continue working as a nurse, and more do not want to work than have not. Regarding nurses who have returned to practice due to COVID-19, 90.7% are still working as a nurse. Also, 54.1% intended to continue working as a nurse in the future. Lastly, I would like to talk about our future plans of action. I need to securing the quantity of nurse, development of support system, including mental health support. training highly specialized nurses, certified, especially infection control nursing, and stressing cooperation between healthcare, health centers, care facilities, home visits, nursing care, etc. for response to COVID-19 patients. JNA conducted a hashtag campaign using Twitter, Nothing Now, What I Can Do Now. That was in order to raise public awareness for infection prevention and send out the message of empathy and encouragement to nurses working at the front line. This photo is our workplace illuminated. Thank you very much for your kind attention.
Thank you very much for 3 presenters, and thank you for the perfect time management. Now we have Professor Suzuki from Hosei University for the comments and questions for these 3 very rich presentations. Professor Suzuki,
yes.
please.
Can you hear me?
Yes,
Okay.
I can hear you.
Okay. I'd like to make a comment and question on these 3 presentations. The general comment is that the spread of COVID-19 in Japan suddenly brought to the surface various problems and contradictions in labor markets and employment relations that had existed since early 2000s, but had remained relatively latent, except the period of the financial crisis from the 2008 to 2009. First, I'd like to make a comment on Professor Yamada's presentation. As the presentation shows, the technical interns cannot switch jobs freely. When technical interns were dismissed by employers because of the severe economic recessions under the pandemic, the status of these dismissed interns automatically become illegal. Related to this, another question is not Immigration Service Agency of Japan, the government organization in charge of the immigration, provide these technical interns with opportunities to find other jobs by granting them another status of residence, such as designated activities, in Japanese, 特定活動. And since the question seems to be very long, I just briefly mention this. The third question is if there's any NGOs or labor unions which provide counseling services or assistance to these dismissed technical interns. And the fourth question is kind of a big question, so I skip over it. Next, I'd like to make a comment on Professor Takashi's presentation. The presentation shows unemployment rate did not rise during the current crisis as much as it did during the financial crisis of 2009. It also shows that the number of non-standard employees, especially female non-standard employees, decreased drastically, about 1 million people, from 2019 to 2020. Concerning this point, I have 2 questions. Despite these non-standard workers who left job markets voluntarily or involuntarily stop seeking new jobs? In other words, did they become a part of non-labor force population? If they were main wage earners when they are employed, after they leave their job, they must be they must be in a very severe economic condition, economic difficulties. The second question is drastic decrease of non-standard workers in service industries is understandable because a substantial proportion of the labor force in these industries are non-standard employees, and also consumers' demand for these services declined due to the government's declaration of emergency. So my question is, why non-standard employees in the manufacturing sector also decreased drastically? This is the second largest decline after accommodation, eating, and drinking. Another question is about is the leave allowances. The presentation shows that the gap between the standard and non-standard employees from another perspective, that is, the government provided companies with subsidies so that they can pay leave allowances to employees without dismissing them. So that's why the unemployment rate did not rise rapidly. However, the data shows that the amount of leave allowances or proportion of the allowances compared to the previous amount of the wages is much lower among the non-standard workers than the standard employees. And my question is, why do so many companies take such a blatantly discriminatory policy in the payment of the leave allowances between the standard and non-standard workers? Okay, then next I go to the Professor Omura's presentation. I'm still on time. Okay. All right. What Professor Omura showed the results of the JNA survey. That what struck me most about the result of the JNA survey is that although many nurses devote themselves to medical care of COVID-19 patients under very hard working conditions, about 20% of them experienced a prejudice or discrimination. Their family members, neighbors, and the parents of their children's schoolmates expressed prejudice against the nurses as a potential spreader of the disease. And my question related to this point is that, and also this question is directed to the audience too, is the nurses and others in medical professions who treat COVID-19 patients in United States or other countries also experience such a prejudice from the people not related to medical professions. And sorry,
You're okay.
Okay. This is the first point. And second point is about vaccination. Vaccination people of the medical people in the medical profession started in the mid-February. So I think the proportion of those who received the vaccination increased, including nurses. And my question is, I'd like to know if there's any positive effect of vaccination on nurses' attitudes toward their medical duty. For example, do they feel more protected and less stressful when treating COVID-19 patients? If so, maybe the rate of the number of people who leave their jobs might decline, or maybe this is a kind of optimistic picture. And do you think that the situation of nurses' working conditions do not improve immediately particularly because the increase of COVID-19 patients in serious conditions due to the spread of the more infectious variant of COVID-19? Okay, that's all.
Thank you very much, Professor Suzuki. Now, I'd like to I'd like all the presenters to respond briefly to Professor Suzuki's questions. Then I'd like to open up for floor to ask questions to presenters. So please start from Professor Yamada to reply to Professor Suzuki.
Yes, I think the first question and the second question are related to each other. So referring to an episode of technical interns, so I mentioned that these interns can stay in Japan with special permission from government. So this permission was introduced by the government for the unemployment of interns due to COVID-19 pandemic. So this is to switch the qualification of technical interns to other ones. So for example, they are be allocated to other employers who are able to train these interns adequately, so they can continue to stay in Japan in a year. So in short, if they cannot be allocated to other employers, it is difficult for them to stay in Japan. So I think that in the pandemic, it is also difficult to find other employers for these interns. So that's it.
Okay, thank you very much. Then next, Professor Takahashi.
Yes, thank you for meaningful comments and questions, Dr. Suzuki. First question, you asked whether non-standard workers, in particular female non-standard workers, become non-labor force. My answer is yes. The amount of labor force has certainly shrunk during the pandemic, and it is also clear that non-breadwinners, such as female part-time workers living with their husbands, are more likely to quit job seeking and become non-labor force. Another second question was employees in manufacturing industry. In my understanding, the number of employees in manufacturing industry started to decrease in 2019, just before the pandemic. So I think this trend is different from what we call the COVID-19 crisis. So, and the final question, it was about the discrimination in leave allowance. As Dr. Suzuki pointed, payment of leave allowance was discriminatory, and such discrimination is deeply rooted in Japanese labor market as a whole. So in this broad sense, disadvantages experienced by non-standard employees related to Japanese style employment. However, in my presentation, so I defined the term Japanese style employment system in a narrow sense, very narrow sense. I defined it as a bundle or mixture of HR systems, including long-term employment, seniority-based wage system, and enterprise union, etc. So, and such employment system is typically found in large manufacturing industries. So, so in my presentation, I concluded that the COVID-19 crisis occurred outside the Japanese style employment system. However, in a broad sense, Japanese employment practice that discriminate non-standard employees affected them. Thank you.
Thank you very much. Finally, Professor Omura.
Hi. Thank you for your comment, Professor Suzuki. I answered the second question. I hope the vaccination relief their nurses and their families of that they have fear and some fear and anxieties. But I think there are some reasons why so many Latin nurses have been produced. We have many problems. There is long working hours and night shift burden. Two shift work system often imposes 16 hours or longer on a night shift. So this COVID-19 is an impact to nurses, but basically we have so many problems. So I hope taking this opportunity, I hope the improve the working condition of nurses. But I'm sorry, that is my answer.
Okay, thank you very much. Now I'd like to open up for floor to ask questions to presenters. If you have any questions, please raise your hands, or you just simply start to talk.
There's a
fine.
one hand. I saw one hand raised.
That was actually clapping, I think. That was,
okay.
yeah. Does anyone have questions or comments?
If possible, I'd like you audience to
Yes,
give the example of the discrimination against medical workers, if it exists also in the United States or other countries.
Can anyone answer to the Professor Suzuki's question about the discrimination against essential workers in other countries?
Well, hi everyone. It's Joey from New York City. It's very difficult to answer that because, for example, here in New York City, the essential workers is also including those delivery person, including myself, who also teaching online. So I give you an example. The definition of essential workers is when I got a vaccination. So in New York State, when they ask the classification, are you a part of the essential workers? And it's also from the time to time, it's also changing. But overall, if I can relate to immigration, which also similar to Japan condition, is that also in the UK as well, I've been through vetting processes, is that, you know, when they finished one type of job with one employer, to change it or to switch it is very difficult. And before, when the employee change, they're having such a big trouble. And as a result, employees hesitate to report the issue. However, the new, not really new, but there's in the US, we have what's called U visa. U visa is for those people who experience some kind of discrimination and also victims of any kind, but this person have to come forward and make a report. So that's perhaps, you know, that's answer your question, your relation question here. But the U visa is regardless whether it's COVID-19 or not, or pandemic, but that's kind of discrimination of those people, including students in the US. When they finished, for example, from certain visa, they must leave the country and come back again, unless otherwise they must secure an employment.
Thank you very much.
If I may, though, I just want to ask a question about the condition in Japan itself, because I'm actually received GSPS research grant, and I've been waiting for Japan to open. So I'm not so sure what is the real situation. I've been paying attention to the news and also paying attention to the Japan consular here in New York. They still are issuing it. So what is it really going on in Japan for a foreign researcher, if somebody can share some insights?
You mean if there's any changing situation with regard to foreign scholars to come into Japan right now?
That's
Okay.
correct. Yeah, or maybe
Yeah.
some prediction. When do you think is the prediction Japan will allow the foreigners to come to Japan to conduct research?
Yeah, I don't know. It's well, probably it depend upon the timing of the completion of the vaccination, I guess.
Mhm. Yeah.
And Japan is slow.
Yeah.
Unfortunately, it's very, very slow. And I'm not quite sure how long it's going to take for us to be vaccinated.
Mhm.
I guess that you are already vaccinated, right?
Yes,
Yeah.
I have. Yeah.
None of us, I think,
Oh,
in this panel have got a shot yet.
oh,
At all,
really?
even though
People over 75 years old can get.
Oh,
shot.
wow. I'm really surprised. I'm shocked.
And
yes, it's
also,
shocking.
yeah, also another important factor is that now in Japan, Japanese people are in the very big controversy over whether they host the Olympic game or not in this summer.
Mhm. Yeah, yeah,
And I'm against, and I participated in the petition against that,
Yeah.
because that creates a big health problem,
Mhm.
that the government is kind of insisting on hosting the game, and
yes.
and if the Olympic game was held and the situation get worse,
Mm.
then foreigners cannot come to Japan,
Mhm. Yeah.
forever, but for a long time, I guess.
Yeah. I just follow up on that one, just on the vaccination rollout. I'm really surprised that none of you in Japan got vaccinated. Is it because hesitation, or is because it's not yet available
Well,
in
it's
Japan?
not.
It's not
Yeah,
available.
we are
What?
gradually lowering the age, but it's a step by step, and maybe from middle of this month, some I think in some places the people below the age of maybe 65 can get a shot, I guess.
Mhm.
Professor Omura, do you have any idea why we are slow on this process?
Yeah.
The governments request us to acquire the human resource to so every day we call we call many calls and requests from government or citizen or other people every day.
So every time you get those calls, you have to contact with those latent nurses to come back again to be the
Yes.
personnel. Okay,
Wow.
that's ongoing.
Oh,
All
yes,
right.
going.
Yeah, because when I'm doing research about Japan and ASEAN, and I was quite surprised when I almost can't believe what I have heard in the news about Japan vaccination rollout. For example, in Vietnam and also Indonesia and Thailand, the majority of senior citizens, regardless what they do, is actually the number. I was like, am I reading this statistic comparison between Japan and any other Asian country is correct? That's why I'm quite hesitant when I ask you this question, because you guys in Japan, right? I was like, oh, so Indonesia is almost like 75% of the senior citizens already got vaccination from Sinovac, and a few of them got from AstraZeneca. But in Japan, what kind of vaccine do you guys have?
Pfizer, Moderna, and one more. AstraZeneca is also
AstraZeneca?
available, no?
Okay.
Yeah.
Okay.
I'm not
All
quite
right.
sure.
Oh, wow.
Three
It's
types.
tough.
Yeah,
It's tough.
it's tough, yes.
Tough.
Any other questions? We're already time's up, but if you have any questions. All right. Thank you very much for presenters. It was a very data-rich and a very concise presentations. I personally enjoyed a lot, and I really thank you for your perfect time management for this presentation. And thank you for Professor Suzuki for the questions that really clarify the points we want to deliver through this session. I also thank you for the audience. Although it's not many, we really appreciate that to attend, to be interested in the Japanese situation.
Thank you very much.
Thank you very
Thank
much.
you.
you.
Thank you.
Thank you.
Thank you very
Thank you
much.
very much.